Professor Momen Mahmoud Hamdi, Professor of Ophthalmology in Ain Shams University, and my topic is retinal involvement in pulmonary arterial hypertension. At first, I would like to express my deep thanks to Professor Ashraf Abbas al-Maraghi, Professor of Pulmonology in Ain Shams University, for inviting me to contribute in the Pulmonology Congress of Ain Shams University with this interesting topic. The interface between eyes and lungs is well known through the effect of TB on the anterior segment of the eye and the posterior segment of the eye. Sarcoidosis is a well-known cause for both anterior and posterior uveitis. Valsalva retinopathy is a pre-retinal hemorrhage which occurs from intensive coughing. The bronchospasm from beta blockers in the treatment of glaucoma is a well-known side effect on the chest. The COPD also has a lot of perioperative implication during anesthesia and intraoperatively with eye surgeries. And recently, COVID has been proved to affect the eyes in several ways. PAH is a high blood pressure in the pulmonary arteries. This may be idiopathic mainly, or due to inherited disorder and gene mutation, or due to connective tissue disorders and many other causes. The main pathology of this disease is progressive loss and remodeling of the pulmonary arteries with right heart failure and death. Recently, genetic and molecular background are incriminated in the pathogenesis, namely mutation of the BMPR2 gene with proliferation of the vascular smooth muscles and release of endothelial damage factors such as in scleroderma and other connective tissue disorders leading to vasoconstriction, and ultimately a vascular pathology is in the form of vasoconstriction, muscularization, and calcium deposit in the large pulmonary arteries. PAH also exhibits systemic vascular dysfunction such as abnormal cerebral blood flow, skeletal myopathy, intrinsic disease, vascular ocular manifestations. So it is not an exclusive disease to the lungs and right heart only. As we see in this diagram, there are many system affections, and I'm concerned with in my topic with the eyes and mainly the retina. The retina is the innermost neurosensory layer of the eye, which is divided into anterior segment and posterior segment. The posterior segment also constitutes of, together with the retina, of the choroid, which is the middle vascular layer, and the optic nerve head, and the posterior segment is filled with the vitreous gel or vitreous humor. The retina is composed of 10 layers from outward to inward. Outward near the sclera, the retinal pigment epithelium, then the photoreceptors, and many other layers, ending with the retinal nerve fiber layer most internally and the internal limiting membrane. Among these layers, blood vessels are found from the internal limiting membrane to the outer plexiform layer. The retina requires a continuous blood supply of highly oxygenated blood to keep it nourished, and this comes through a complex blood supply. The arterial blood supply is mainly through the ophthalmic artery, which gives the central retinal artery, that is an end artery that supplies the inner layers of the retina, and the posterior ciliary arteries supplies the choroid and the outer layers of the retina. The venous drainage is through the central retinal vein and the vortex veins, which join the superior and inferior ophthalmic veins that drain into the cavernous sinus and ultimately to the internal jugular vein and the superior vena cava. So, how does PAH affect the eyes? If left untreated or poorly controlled, PAH will lead to elevated venous pressure in the superior vena cava and the ophthalmic veins, reducing venous blood flow from the eye. And this will lead to congestion of the episcleral, retinal, and choroidal circulations. So we have multiple ocular signs and complications that may occur with PAH, such as the ciliary body choroid detachment, exudative retinal detachment, central serous retinopathy, central retinal vein occlusion and venous stasis retinopathy, dilated episcleral vessels, secondary glaucoma, and even transient myopia. In this picture of a 25-year-old male with heritable PAH associated with gene mutation, and also his mother had the same disease, we can see the abnormal episcleral vessels, which are seen in both eyes. This maybe can be seen also in familial PH with gene mutation and even in unaffected carriers. Other important questions for further research are to be answered in the near future. First, can the ocular vascular changes be considered primarily as a part of a systemic disease? Can PAH treatment with vasodilators affect ocular vessels and congestion? And can PAH cause edema of the optic nerve? Since it is a recent topic and the recent classification, recent studies and case reports about the relation of the eye with PAH is not that much in the literature. However, some interesting studies can be highlighted in my presentation. The first one is the relationship between retinal microcirculation and idiopathic PAH. In this study, echocardiographic examination was performed within 24 hours of ophthalmological examination. OCT angiography, which is a high-resolution scan for the chorioretinal microvascular network in the different depths of the retina, was captured. And the perfusion of the superficial and deep capillary plexus and the choriocapillaris plexus flow area were significantly found to be lower than in healthy controls. This positive correlation of retinal perfusion in these capillary plexuses with right-sided echocardiography and hemodynamic measurements unveiled that retinal microcirculation is affected by the pressure alteration in the pulmonary circulation of the PH patients. A case report also was published for a case of acute serous retinal detachment in idiopathic PAH for a 44-year female with acute transient visual loss, and as we can see in the OCT, there is subretinal exudation of the CSR. This was further clarified in another study of venous overload choroidopathy as a hypothetical framework for CSR and allied disorders. And this study clarified that since the CSR fluid leakage is at the level of the macula and lead to detached macula, and the fluid originates mainly from the choroidal vascular hyperpermeability, the choroidal vascular findings in this study, as they studied by the OCT angiography and the indocyanine green, showed that the venous pattern in CSR is more or less similar to the pattern that occur following occlusion of the vortex veins and the carotid cavernous fistulas. Another interesting case was published with a bilateral central retinal vein occlusion in idiopathic pulmonary arterial hypertension. This was a 33 years old female with a history of PH presented with progressive vision loss in the right eye and subsequent deterioration of the vision in the left eye that progressed 2 weeks later. As we see in the picture, there is central retinal vein occlusion in the right eye and venous sesus retinopathy in the left eye, which progressed within 2 weeks to central retinal vein occlusion. This was confirmed by clinical examination and investigations, and it's important here to state that PH is a risk factor for vein occlusion, retinal vein occlusion, and it may be bilateral. Another interesting case of bilateral retinal detachment as a sequel of pulmonary arterial hypertension was published, and this was a case of a 48 years old female with PAH and positive family history who complained of gradual worsening of vision in the right eye, and this was 3 years after diagnosis with PAH. There was also increase in the distortion of the image bilaterally. Fundal examination revealed bilateral retinal detachment without signs of intraocular inflammation, although a rare diagnosis, but it should be well known that exudative retinal detachment is one of the complications of PAH. It is successfully treated medically by aldosterone antagonists such as eplerenone. Rarely surgery may be needed, and it is successful in 95% of the cases. But here, it's important to state that overlooked etiology by the ophthalmologist lead to life-altering consequences. Finally, this is an interesting study in 2022 by Dupont, who studied the use of vision for analysis of retinal vasculature in PAH. VisGen is a non-invasive computer program that assigns branching generation to large and small vessels, and it was utilized to investigate vascular alteration in fluorescein angiography and color fundus angiography to investigate disease progression in PH. As we see, she studied vessel tortuosity, vessel area density, and fractional dimension ratio. These all helped her to conclude that PH patients had aberrant retinal vasculature in fluorescein angiography imaging, that vessel tortuosity was increased in PH irrespective of the subtype of the PH. Vascular changes are mostly similar bilaterally. Rarely each retina may show distinct vascular pattern. Color fundus angiography in conjunction with VisGen is safer than fluorescein angiography in monitoring PH patients, and VisGen here is proved to be promising in identifying vascular pathology earlier and in more subtle vascular alterations in PH, as well as studying disease progression. So as a conclusion, PAH is a recent interface between pulmonology and ophthalmology, and awareness, researches, and interaction are expected between both specialties. Since it is a systemic disease, ophthalmological referral to monitor ocular pathology is important. Non-invasive ocular techniques such as the OCT angiography and color fundus imaging may screen the PH with the potential to quantify and detect disease progression. PH is a systemic risk factor for a variety of ocular disorders implicating pulmonology referral. Overlooked etiology by the ophthalmologist may lead to life-altering consequences. Thank you very much.